everyone, welcome to another episode of Before and Beyond. I'm Dr. Erin, a general dentist here at Dental Designs, and today I'm going to be talking about chipped front teeth and whether you can do anything about it. So, two possible scenarios. One, I am just having a regular review visit, scaling polishing with a patient, and I notice that there are some little uneven edges of their front teeth that looks like it's been chipped before. I asked them, hey, is there something that you might want to do about this, or have you noticed this before? Sometimes the answer is yes, sometimes it's no. Sometimes patients say that they're not so bothered by it, or they tell me that yes, they've noticed it, but they have been told before that whatever they do to fix these front teeth might chip or break again easily. Another scenario would be a patient who has a history of a larger fracture of the front tooth, usually because of trauma or an accident, and they've had it restored before, but it doesn't look so nice anymore. Right. So let's run you through some possible options if these are scenarios that you have noticed before yourself. Okay, let's start with more minor chipping. So over here I have a photo of some front teeth. You can see that the two front teeth in particular over here okay, so this one here and this one here, they both have somewhat uneven edges. I would say that the one that you see on the left, that is actually the right central incisor. The edges are a little bit uneven, but it's not so bad. The one on the left, it's more noticeable that there is this concavity of this chipping within the tooth. For the one on the left, I would characterize it as really mild. It could be left alone altogether. One option I might sometimes offer would be to just simply take our instrument and just very gently kind of polish down to even out the appearance of that tooth. But for this guy right here, we can't do the same because it would change the height of the tooth altogether too much. So what we'll do for this one is that we would place a really small, subtle looking filling on this area just to maybe give it some height again and to try and match the shapes of these teeth to each other. Please excuse my rudimentary drawings. Yeah, so for these really minor ones, the filling actually is really non-invasive. I usually wouldn't do anything to remove any tooth surface. We'll simply clean it out really well, sandblast it, use acid to etch it, just part of a composite resin procedure. And then we would select a right shade to match the neighboring tooth, and then using some layering techniques, we would achieve the same kind of tooth angles to match the shape of the teeth together. This is a really minor procedure. Usually you can get this done within less than half an hour or so. And for all kinds of work that we do on the front teeth, just for me, I definitely offer a review visit for people so that they can come back and we can have a discussion on how they feel about it and if there's any modifications that they want to have done. We always take a photo after the work is done as well to show them what it's like, and so that also I can get in my downtime I can take a look at them again and just kind of note down if there's anything that we might want to modify on a review visit. Alright, and then moving on to maybe more moderate chipping. So this person here went through an Invisalign process, but they had some history of chipping that we can't fix with Invisalign because we have gotten the arrangement of the teeth where they are. We can see that the gum heights are really even here. These are really good. Okay, I'm so sorry. Please excuse my drawing. But what we're more focused on would be the portion here. So how their teeth look. So for her, yeah, definitely we can see there's some chipping right here. The challenge here was to kind of establish a new length of the teeth that we wanted because both of these teeth have some chipping. So what we do is that we can compare the desired end result to maybe the possible existing intact parts of the teeth. So these are the parts of teeth that haven't been chipped before, and we're gonna try and maybe match the chipped areas to these heights. Other things that we also consider is maybe the proportion and also the curvature of her smile, so that we can create a nice kind of even, beautiful smile for her. The other thing that we can notice here is that she has a tooth right here that is a lot shorter than its neighbor on the other side, this one here. And we can also restore that actually using this filling. Yes. So moving on, let's see. This is just a general example of what we call a shade guide. There are many different colors of teeth and different hues, different levels of lightness and darkness, and then afterwards as well different translucencies. So typically we use a shade guide to just kind of get a rough idea of what color someone's tooth is resembling the most. And then from there, there's a lot more technicalities that go into what makes up the appearance of a beautiful natural tooth. Everyone is different. If you're working on just one or two teeth, we would want to match these to their neighbors most of all. And this includes things like where the translucencies of the teeth change from top to bottom, how the colors change as well. And we then employ a layering technique. So imagine like kue lapis, we're building up the tooth layer by layer. So it's not like we're just taking a bit of material, rolling it up, pasting it on, shaping it, and calling it a day. Most of the time, to achieve a nicer result, we put it on incrementally in small layers so that we can achieve different levels of translucency through the tooth. So imagine almost as if you're looking at the top of a pond, you're looking downwards. The amount of water, like transparent water that we're looking through, would say affect how the more opaque object underneath looks like. So something like that. We use this idea to gauge how we want to layer the tooth. And yeah, I think that this is a very fascinating art and science combined together that we employ to achieve the most beautiful, natural, aesthetic results. So this is someone else that we saw with more major work that needed to be done on her front teeth. So she had some oat fillings here that were discoloring. She has some chipping here and here, and we can also see that the height teeth are not so even between these ones at the side. So for her, we would have to evaluate the situation by removing her oat fillings, and then we will try to restore them, once again matching maybe what she already has. For example, this area is still her nice natural tooth color and shape, so we're going to try and match this area to this. And for this smaller chip here, we had the option of either maybe just placing a bit of material here, or like I mentioned right at the start, maybe just modifying or polishing down the edge slightly to even out the appearance. So for her, we worked on the 3 teeth here. So we worked on these guys, this one, and this one. She really liked how they turned out, and so we ended up actually also adding material to this tooth here to lengthen it slightly so that all the teeth looked more even. Okay. Lastly, I'm just going to quickly talk about this other case where we can see that the main issue here was really that one of the teeth looked shorter than the others even after Invisalign was completed. So this tooth is a lot shorter than this tooth. Same idea, even though there was no fracture on this tooth, we can try to layer on different translucencies, colors of composite material in order to match these neighbors well. For this case as well, I generally prefer not to actually prepare or drill away any part of the natural tooth. I like to leave it alone, but just relying on observing the differences in translucency through the tooth to decide how thick and what opacity of material I'm using over the areas so that we can achieve a natural result. The other thing interesting to note for restoring these kind of front teeth would be the angles of the tooth. So you can see here where the light reflects off. Every tooth has slightly different shapes, and this affects how our eyes perceive them. So when we are changing the shape of the tooth, adding to it, we want to kind of notice these angles, be really observant, and try to match them really well to their neighbors or their contralateral tooth, so that we can achieve a nice aesthetic result. So yeah, this is a rough run through of the thought process that I go through when I see front teeth that can require a little bit of work just to get them to look nicer. And I think that this is a really feasible option for lots of people. Then again, you need to talk to your dentist. Placing little fillings like this is considered a more conservative option than doing something like a veneer or a crown. So if there's something that's crossed your mind before, please feel free to schedule a visit with your friendly dentist in order to find out more about your options. And we'll see you on the next episode of Before and Beyond. Bye bye.